In this video, I'm going to go through 5 top tips for using your RockPods. Number 1, keep them clean. There's nothing worse than reaching for your pods only to realise that they're all in the sink waiting to be cleaned. Now you can easily clean them with medical soap and water, tissue and alcohol gel, or medical cleaning wipes. It may help to have 2 sets of pods, but you will still need to clean them in the end. Top tip number 2, use a wax or oil to seal the edges and create a good vacuum with the pod. If you're advising patients to do this at home, if they're self-applicating with their pods, then simply using cooking oil will work just fine. Number 3, don't leave the pods on for much longer than a minute. And in fact, on our courses, we advise 30 to 90 seconds. And this is because it's deemed to give the best balance between therapeutic input and minimize the after effects. Now, the after effects I'm referring to are the red circles that often take a few days to resolve. They're not harmful and they can be reduced by dialing down your treatment times. Number 4, avoid excessive twisting. RockPods are not designed to slide over the skin, and while they can if you hold the pod in a certain way and use enough emollient, I would avoid any repeated frictional sliding over the skin like this. What can happen here very quickly is the rubbing of the pod over the skin can cause a friction burn and some discomfort for the patient. Number 5, and this is perhaps the most important, always warn patients about the marks that may occur after cupping and the use of the RockPods. Gain consent prior to application, and in most cases, cupping will leave these red circles, sometimes referred to as bruises or ecchymosis. Now, whilst these are not harmful and they do fade over time, sometimes weeks if the cups are left on for extended periods of time, your insurer will want to know that you have adequate training and you've informed the client and gained their consent. Hopefully these tips were helpful. Please share them and give the video a thumbs up if you found it helpful.